The pandemic, nurses across the country have been dealing with understaffing in hospitals, leaving them overwhelmed and burned out.
Now they're working to combat these issues with state legislators to create new staffing standards for hospitals.
As Leslie Huff explains, there's a bill that the Ohio Nurses Association believes could be a turning point for the state's healthcare system.
The Ohio Nurses Association is standing behind a new bill that would establish minimum staffing standards for nurses in Ohio hospitals. It's called the Nurse Workforce and Safe Patient Care Act that, if passed, would be enforced in every hospital in Ohio.
It establishes safe staffing standards in every hospital in Ohio. It also preserves the staffing committee so that nurses have a voice in staffing issues in the hospital.
The bill would create a confidential system so that nurses and patients could report any hospital that doesn't keep enough nurses on staff without fear of retaliation. The plan also calls for a $20 million program that provides loans to cover nursing school that are forgiven if the student finishes the program. Lucas says he's hopeful the bill will pass, but expects some pushback from the Ohio Hospital Association. His concerns may be valid. In a statement, the OHA voiced skepticism of the bill, saying mandated approaches to nurse staffing limit innovation, reduce the flexibility needed to respond to a patient's changing care needs, and increase stress on a healthcare system already facing an escalating shortage of nurses. However, Lucas says this really comes down to the health and safety of patients.
Patients come to the hospital for nursing care, and they deserve to have enough staff to meet their needs. And so when those needs aren't met, that means increased mortality for patients.
With more local news, I'm Leslie Huff.